Pakistan.
Okay. Uh, Sajjad, would you like to start with, or should I
I
go ahead with the situation?
yeah,
And
I think you just go ahead and just inform the situation in Pakistan. I think Dr. Qazi, you go ahead, please.
okay, thank you very much, Sarab and everybody, the chair, Dr. Chong, and the situation in Pakistan at the moment. We have a positivity rate of 3.65, and in the last week, we had about 7 to 10 deaths per day. And yesterday, in the last 24 hours, we have only one death. And the new cases in the last weeks is a few hundreds, about 693 new cases were found in the last 24 hours. And almost 30,000 tests were carried out per day. We have 177 critical care cases in the hospitals. Regarding the vaccination, we had the initial doses of vaccination about 138 million, and fully vaccinated are 129 million. About the booster doses, we had 35 million people being given booster doses, and we are still educating for booster doses. Additionally, for those who had in the last their last dose 6 months before. So the booster doses are the Pfizer vaccine, which are provided free by the government, and the gap between the two booster doses is about 28 days. So, situation still persisting, and the advocacy of wearing masks and keeping distance and hand hygiene is there. The hospitals are advised to take care and follow the SOPs of COVID-19. But the general public, they have a tendency of, you know, accepting it as a normal, new normal. And people are not seen wearing masks in mass gatherings, the bazaars, the markets, and everything seems to be normal. The travel restrictions, there is no requirement for PCR testing coming to Pakistan, but one has to be fully vaccinated in order to travel to Pakistan. And in fact, there is a requirement of fast track. Fast track is the application where you put in all your, contact list and everything. That is the only requirement. If you want to travel to Pakistan, you have to be fully vaccinated, and there's no requirement for PCR. So that's all about Pakistan. I think if Asad Sajjad would like to add anything, uh, please.
Thanks. I think you have explained everything. I just add that maybe it's happening in other part of the world that the people are absolutely ignoring the coronavirus. In Pakistan, everything is normal. The marriage ceremony, the restaurant, the market, everything is normal, and nobody is wearing the mask in anywhere, in any gathering. So this is the attitude of the public. The people are not listening what we are saying through the media to follow the SOPs for the coronavirus, but people are not listening to anybody. But the thanks God, the number of cases is In between 500 or 600, sometimes 300 per day in Pakistan, and the positivity rate is 3% and below 4% from the last 1 month. So this is the situation. I don't know the other part of the country. The National Medical Association will tell what is the situation going on in their country. Thank you very much.
Thank you. And I believe there is no monkeypox case being reported in Pakistan.
No, absolutely not. No monkeypox, but we have a dengue problems here also nowadays, and because of the rainy situation, the gastroenteritis cases are there.
Okay. Can I have Marie from Japan? It's a long-awaited update which has been pending. Yeah.
Thank you very much. Yes, we have many people have tested positive. Yesterday, it was over 200,000 cases has been reported tested positive, but only 100 people are dead. Dead people who was positive for COVID-19, and also the spread is caused by the Omicron BA5. So infectivity is a little bit higher compared with BA2. Interestingly, there about 1/4 the dead person were caused by not COVID-19. So mainly older people who has already sick get worse because of COVID-19 infection. So average of the people who died is about 80 years old. And the 2/3 of people is admitted to the hospital prior to the infection, or who were in the elderly home or care facilities. And I think that there is now in Japan, it has been controlled, and the who is coming to Japan is needed improvement of negative testing of PCR. And everybody, now Japan is open for the business person, but not for sightseeing people. It's limited to only on the tour, and who had the insurance and the proof of negative of PCR prior to getting the airplane. So that's all for reporting from Japan now. Thank you, Sabra.
Thank you, Dr. Marie. Marie, is there any monkeypox cases there?
May I ask a question to Japan?
Sure.
Yes, sure.
We heard that if the Japanese people, they travel overseas and when they come back, they need to be quarantined. Is it so? Is it
Excuse me.
mandatory?
You asking me coming to Japan or coming from Japan?
Coming back to Japan, the Japanese people who have traveled overseas, like if they have traveled to Pakistan and when they go back, are they required to go for PCR testing? And then, despite the fact that they are being fully vaccinated along with the booster doses, and they need to be quarantined, is it so?
Yes and no. So to enter Japan, you need a proof of PCR test negative prior to about 2 days before your departure. And if you are fully vaccinated, I mean 3 times you vaccinated, there is no test at the immigration. But if you don't, if you are not fully vaccinated, you have to go over the test again at the airport. So if you have a proof of the positive or test positive, your PCR test become positive. You have to quarantine at the site of the hotel or somewhere else. Am I answering your question fully, or
Oh yes, thank
are there
you. That
anything
is
I
what
can
the
say?
international protocol is today in place. I mean the same. So there's nothing extraordinary for. I was told by somebody that for the Japanese, Taiwan, and people from Hong Kong, they still have very hard rules when they come back to their country to quarantine and everything, despite the fact that they are fully vaccinated. So what you are telling is the international protocol that is being followed throughout. Thank you.
Thank you.
Thank you for asking. And I want
Thank
to
you, Doc.
answer your question, Sabra.
Yeah.
Oh, yeah. There are 2 cases of monkeypox in Japan. 2 cases has been reported recently. Okay.
And what's the Japan protocol? Are they going out for the vaccination, or are they, what are they doing for the virus for monkeypox?
Oh, we are not discussing detail right now, but
Okay.
there is discussion about vaccination or do something for the immigration at the point of immigration, but it's not so transmittable. Infectivity is not so high compared with COVID-19. So we are looking for the detail of monkeypox in the other countries. Thank you.
Okay. Thank you, Dr. Murray. It was nice to see you after a long time. I hope we can get
Yeah.
an update every week.
Yeah, thank you. I'm going to try to attend every week. Thank you.
Thank you. Thank you. Can I have Dr. Akhtar Hussain from South Africa?
Hi, good morning, everybody. In South Africa, last 24 hours, the new cases was 354 and 5 deaths. But that is the range between 200 to 500 for the whole week. That's a variation. And the death rate never went to 0. It's around 2, 5, 10, around this figure. And the recovery rate is 97.3%, and active cases still around 5,000 total cases active. So far, South Africa is positive is 4 million and tested almost 25, 26 million cases. The death, we have crossed 100,000, and the vaccination rate is very slow. Total 37 million is vaccinated. And the figure on vaccination is more on above 50 and 60. They have covered around 55, 60%. And the traveling is only you need a vaccination card, the no restriction. Even in the plane, you don't have to put a mask. And borders are open, economics are coming back. The new problem now is the viral infection, influenza, RSVV, and para-influenza numbers are increasing. And because now it's a winter in South Africa, people are not wearing masks. Now they're rushing to the GP for a flu vaccine and getting sick for 3 to 4 days and absent from the work. So last 2 years, we didn't see so many cases of influenza and flu virus, but now it's coming back. So that maybe the mask was preventing and helping. Schools are open, children are not wearing masks even in the school. So overall situation in South Africa, COVID-19 is improved. Hospitals, yes, hospitals are empty, very few cases. The deaths are mainly because of the comorbidity. Thank you, Saurabh.
Thank you, Dr. Akhtar. And Akhtar, is there any, again, monkeypox cases over here?
Yes, we had two diagnosed monkeypox. One was in Cape Town, one was in Johannesburg area, but both of them history not travel from overseas. There were no sexual LTGB or man-to-man cases. It's just an individual case, but we haven't heard any after that.
Okay. Thank you, Dr. Akhtar Hussain. Can I have Dr. Matanda Pillai? Dr. Pillai, can you unmute yourself and please give an update for India? Yeah.
Thank you, Saram. Very good morning. And India, the incidents are more or less stabilizing. We have almost 20,000 cases per day. The number definitely is coming down from 24,000 to now it is almost 20,000. And this again is in certain states and certain regions. So it is no longer a pandemic, no fifth wave. It is a epidemic sort of thing where localized pockets of cases are there. And even the total number of active cases definitely is coming down from 2 lakhs and more. Now it is almost 1.4 lakhs. And the active cases again is coming down 0.3% active cases. That of course, particularly people with comorbidities, almost 43 cases per day definitely is happening. And so the situation is definitely improving, and restrictions no longer exist. Mask wearing, although is compulsory, it is left to the choice of the citizens. Areas where the numbers are more, mask wearing is happening. In other areas, they are not using even the mask. And so it is more or less settling down. Numbers are coming down. Vaccination, about 230 crores of people have been vaccines have been given to the population, but still we find that even the eligible persons for vaccination, there is a small deficit. But then they must have had a silent infection, and the immunology status of the population definitely may be very high. And monkeypox, 3 or 4 cases have been identified. All those are people who have traveled into India. Restrictions of travel no longer exist. Schools are open. Business as usual is happening. Social, political activities are there. Religious gatherings, there's no limitations or restrictions. So that is where we stand. Thank you.
I also believe, Dr. Pillai, that the variant for monkeypox which has been identified is a different variant, which is not a European variant, which is like a US or a Thailand variant. It's like an A2 strain and not the regular B1 strain.
Yeah, since the numbers are very less, not much of importance are being given to that. And even those who got infected, they are recovering and they are kept in isolation.
Okay. Great. So, can I have Dr. Chong from Singapore?
Hi, Sarah. Morning, everyone. Sorry, afternoon. Just to report on what's happening in Singapore is to date, I think we have 1.7 million cases. Our population is 5.something million, 5.4 million. And we have 1.7 million cases, about 1,500 deaths from beginning till now. Case numbers about 8,000 a day. And the vaccine, sorry, before that, number in hospital maybe 600. Those who need oxygen 64. Those who are in ICU about 19, of which 13 are critically ill. So one of our biggest challenges is still the elderly. Elderly, those in the 70 to 79 range and those above 80. Of the total eligible population, about 5% to 3% of them are still unvaccinated for various reasons. So I think that's where our numbers are coming from, mainly from the unvaccinated elderly. And it's always a challenge trying to get these people to be vaccinated. Otherwise, the vaccine-wise, I think about 5 million people have received the full series, the full primary series, and about 4.25 million have received 3 booster or second booster. So that's where we are at the moment. Monkeypox, very interesting. We have 11 cases to date, and 3 are Singaporeans. The rest are foreigners, imported, coming back here to work or whatever. People from, for example, from everywhere, from Estonia, from Britain, from Philippines, from Thailand, from Taiwan, sorry, and also a couple from India. So all these are imported cases, but we have 11 to date. So that's pretty much what's happening here. Life goes on, no travel restrictions, masking still on for indoors, and outdoors no masking. So if you're running around outside, it's okay, but once you enter a building, you need to be masked, and restaurants and so on. Yeah. So otherwise, no travel restrictions coming into Singapore and so on. If you're fully vaccinated, no restrictions at all. Yeah, I think that's what we have to report from Singapore.
So, before we end this meeting, do anybody see any major surge? Because I think COVID is not going on. It's not a concern for a lot of people now, and they are like living their life as usual. But it's also not going off. It's carrying the tail, and it's saying, okay, I'll not let you live properly. I'll still be somewhere back of your mind. And I think there's a lot of fear. A lot of people are traveling in a fear. I've seen so okay, let's make this travel. I don't know whether COVID come again, the pandemic will come again. A lot of things are happening at the fear of happening it, and the comfort zone is still not there. So I don't know who, this is like a general public answer. What's going on? A lot of people just say, forget it, nothing will happen now. But you never know, the world can surprise us again. We keep hearing new variants, new numbers, new names. What's going on?
So the BA5 now, I think it's 80% of the global cases, BA5. It's overtaken BA4. And in Singapore, likewise, the majority of the cases are BA5. And that's why we're still having 8,000 cases a day. Absolute numbers, I remember reading Jetalina's blog. She says that the death rate since the beginning of Omicron has gone up 40%. And 20% are in Southeast Asia, 7% in Americas, the rest in Europe. So really, there's a surge, and because of the numbers involved, that's why the death rate has actually gone up about 40%. So that's what we're seeing really. And these variants, we've delivered more than 12 billion doses globally, but the Omicron and the sisters still managed to pierce this wall of vaccinated individuals that we built. So with impunity. So really, although we have learned to live with it, but it's still exacting its toll. So
also, I think the reason I think we all know, but the COVID cases are still coming. But the reason is what? The vaccination, the immunity which has been built up, the herd immunity. So I still hear a lot of people getting COVID infection. Call it, including the the president of US. So, but it's
some
no
data,
longer a news.
Yeah, some data. So I just took my Moderna on Monday. So today is 5 days ago. So I took my Moderna, my 4th dose. And the data from US, for those above 50, the 4-dose, there's a lot of people who took 4 and versus 3, right? mRNA. So the 4 doses, the 4th dose will reduce your mortality and your severe disease by 4 times. The Israeli data above 60, the 4th dose will reduce your mortality by 2.6 times. But interestingly, all the data shows that if you take 4th dose, you're good for 4 weeks. After 4 weeks, your chance of getting COVID is pretty much the same. So the 4th dose doesn't really prevent you from catching the infection, but it just prevents you from getting severe disease and death. Right? That's really what we're doing. So it doesn't prevent infection with COVID or with BA5. So BA5 is pretty amazing. Yeah. So
in fact, I was reading one of the articles on Johns Hopkins University, which I can share. It says, how does the mortality differs in across the countries? One of the most important way to measure the burden of COVID-19 is mortality. So the difference is the number of people tested. With more testing, more people are mild cases, identify the lower case of mortality is there. Demographic, it depends on the culture, the way of living, characteristics of the healthcare sectors, and major other factors are unknown. So even Johns Hopkins doesn't come up with the answers, and they say that the Peru was the country, and post that Mexico and Colombia with the highest death cases which have happened. Peru was 5.5 and Mexico was 4.9. So yeah, so is there anyone else over here which we are missing? I see some names over here, but the names are not really. So is there anyone else joining in from any other association?
I don't think so, Sarab.
Yeah. So let's call it off for this week, and we will have another session next week. Thank you everyone for joining in. See you again.
I won't be joining you guys for the next 2 weeks because I'm going to Melbourne to see my son on holiday.
Oh, okay.
I'll catch up with you guys.
Have a great trip. By the way, we have a speaker for 13th, and we have a very important speaker. So I will send the details. If you get a chance, please join. Yeah.
Yeah. Thank you, guys, and
Thank you so much.
always a pleasure to meet all of you.
Same here.
Thank you very much.
Thank you, everyone.
Okay, thank you.
Bye.
Thank you very much. Bye bye.
Thank you.
Bye.